Hey guys, welcome back to Medical Coding with Blue. Today's episode is all about medical coding job listings review for the CCA. If you are brand new to my channel, welcome. I am Blue, I'm a medical coder. I have been a medical coder for over 10 years. I really love sharing the things that I know with all of you. So I hope you'll take a second, hit that subscribe button, hit that like button, and at the end of this video helps you, I hope that you will share it. So let's get started. Okay. Now, I am dedicating this video to all future coders and to the CCAs of the world, okay? CCA, if you don't know, is a Certified Coding Associate, and this is offered with the American Health Information Management Association. Now, I will say this. There is a lot of trash talk about the CCA when it comes to the CCA. Now, I'm not going to get into the ugly side of why people trash talk the CCA, but I will say this. If you hear somebody that's trash talking a certain credential, it is because they have a vested interest probably in you picking a certain credential or you going through a particular program. So always consider who is telling you this information. I try to be as completely neutral as I possibly can. I am with the American Health Information Management Association. I currently hold a CCA, okay? I got stuff going on in the back that I'm not talking about on the channel just yet because this is part of my process. But just know that I've got stuff going on and I will bring it out when the time, is right. But sometimes people will tell you, oh no, you really don't want to have that credential. You want to do this credential. You want to do that credential. I don't have a dog in this fight. When I tell you guys that I'm talking about HIMFIELD and AAPC. See, isn't that kind of generous of me? Because most people, if they're with a certain association, they're going to be like, well, and they're going to talk more about that association. And sometimes coders will not talk about other associations. I will tell you guys about both. I will tell you about AAPC and with HIMFIELD. So I will explain all of the credentials because I think you guys can make your own decision on which way to go. The only thing that I have told y'all that I insist on telling you guys is that if you want to be a medical coder, you have to go through a HIMFIELD or AAPC. There are different associations out there, associations I know nothing about, guys. So, but I'm telling you, if you are looking for a job as a medical coder, you have to be certified with one of them because that is who they're looking for. And if you don't believe me, go on a site like Indeed and check and see if any other off-brand, if they're asking for that particular credential. And I think you'll find the answers surprising, okay? That they're not really looking for anything other than a HIMFIELD or AAPC credentials, okay? So, like I said, I'm not going to get into the ugliness about the trash talk with the CCA because I think it's ridiculous. I've gotten 4 very good jobs with the CCA. Very good jobs. Okay, so I'm just going to say that. Now, the pass rate of the CCA is very hard to pass. And I'll have you know this also. There's a lot of things that get tested on this test that people say, oh yeah, well, that's just entry level. Oh, really? You still have to know about inpatient and outpatient. So there's a lot of things you have to know in conjunction to take this test. I'm just saying, okay? So, without further ado, because I know some of you will be like, get to the point, Blue. Here's the job listings that I brought up, and there's tons of them, okay? I'm not gonna say where they are specifically, but I do hop around and do find just different states. But this first one is they're looking for an outpatient coder position for a remote opportunity. Candidate must reside in the state of Texas, Louisiana, Arkansas, New Mexico, Nevada, Oklahoma, or Georgia to be further considered for this position. Yes, it's a remote position, but it's probably because this is a brand new listing. And right now, everybody with COVID and everything, okay, and I'm going to get into that in a little bit more, but responsible for maintaining current and high quality ICD-10 CM and CPT coding of all outpatient diagnoses and operative procedures. Accurately abstracts patient data into the CPSI/Evident computer system. I think that's their system that they use, their electronic health record. Including outpatient coding, all laboratory, radiology, recurring nursing home, outpatient psych, cancer center, clinic, and physical therapy, and ER visits. Verifies charges are correct on all outpatient accounts. It also includes some inpatient psych and inpatient rehab accounts. Accurately assigns appropriate modifiers to CPT codes, enters accounts into medical records hold when further documentation or charge corrections are required, communicates with physicians regarding coding and sequencing questions in all individual cases, reviews medical records to assure accurate admit and discharge dates, and verifies all outpatient orders are signed with diagnoses. This includes various departments, including various departments with and charging issues, including admitting and patient billing, assists with admissions department with medical necessity issues and questions, reviews all X-ray, CT, and your ultrasound reports for diagnoses, responsible for maintaining the unbilled accounts report on a daily basis, assists in all other areas of the department as requested, accurately codes all diagnoses and procedures on all outpatient visits, accurately abstracts all outpatient codes into the CPSI/Evident computer system, including lab, radiology, cancer center, all family, and rural healthcare clinics, physical therapy and emergency room visits and procedures, verify all outpatient orders are complete and with accurate diagnoses for tests and procedures being performed, and work on held billed report for all outpatient visits and or procedures. RHIA, RHIT, CCS, or CCA certification is required. Must have knowledge of medical record content with excellent command of medical terminology and understanding of basic anatomy, physiology, and disease processes. Must know how to operate basic office machines, including a copier, scanner, and computer keyboard. 1 year of outpatient coding experience preferred. Not required. We've talked about this. Preferred means, if you got it, okay, great. If you don't, if we like you, we'll give you a chance, okay? RHIA, RHIT, CCS, or CCA certification is required, okay? And then it talks about the work shift and stuff. So I just want to point out, this position is available for a CCA, okay? Next job listing, and I found these on Indeed, okay? And I'm not putting the exact link because just in case this is being viewed years from now. Hello, future. Of course, these will all be gone. So if you're interested in looking at what job listings are available for medical coders or medical billers, I looked on Indeed, but you can look on any job listing website you want to. Okay, this one is for remote medical coder, HCC coder. If you don't know what HCC is, it's that word that I have a hard time with. Hierarchy. Oh, I can't. Look up HCC because I can't. I get fumbled when it comes to that word. It's hierarchy, right? Hierarchy, but it's hierarchical. There it is. Hierarchical. I did it. It's that word. Okay. So that's what okay. So here we go. Remote HCC coder. We are looking for a certified medical coder for a remote HCC coding position to join our team who is passionate about growing as a professional and moving the healthcare industry towards value-based care. This is a full-time remote work from home position that requires 40 hours per week, Monday through Friday, 8 to 5 Central Standard Time. Okay. I guess if you're somewhere else, as long as you fall under that time, maybe, I don't know. And also overtime during the end of the year. Once you have been working for 2 months, you will be able to adjust the hours from 6 a.m. to 2:30 p.m. Central Standard Time. Woo woo! That's what I work. Those are my hours. I really like that schedule. 7 a.m. to 3:30 p.m. or 8:30 a.m. to 4:30 p.m. or 9 a.m. to 5:30 p.m. So they'll give you a flexible start pretty much your choice of those different schedule times, which is a good deal, you know. This is a full-time position with the hours mentioned above. We do not offer any part-time position schedules at our company, so please only apply if you're able to work for the hours listed. And then it says the duties: identify, collect, assess, monitor, and document claims and encounter coding information as it pertains to the clinical condition categories. Oh, please don't sneeze. Please don't sneeze. Sorry, guys. Okay, I think I'm okay. Verify and ensure the accuracy, completeness, specificity, and appropriateness of diagnosis codes based on the services rendered. Review medical record information to identify all appropriate coding based on CMS, Centers for Medicare and Medicaid Services, HCC categories, hierarchical. Okay. Complete appropriate paperwork, documentation, system entry regarding claim and encounter information, provide support, education, and training related to quality of documentation, level of service, and diagnosis coding consistent with established coding guidelines and standards. Monitor coding changes to ensure the most current information is available. Demonstrate analytical and problem-solving ability regarding barriers to receiving and validating accurate HCC information. What they're saying in that one little phrase is you got to be able to figure this stuff out, and you got to be able to know what these words mean, what like your medical terminology and anatomy and physiology and the disease process and how it all relates. You got to be able to figure this out. That's what that one sentence is saying, okay? Requirements. 2+ years working as a medical coder where coding is 90% or more of your job duties and you were held to quality and productivity standards. Now, here's the thing. When it comes to quality, to like experience and what they consider as experience, somebody had asked me from a previous video, well, I want to do Practicode, and is it okay if I count that Practicode on my resume as 1 year of experience? The thing with that is you can't really do that. It doesn't really count as 1 year of experience because you have to be able to answer the two questions. Accuracy, what was your accuracy standard? And what was your productivity standard? Because they need to know if you can meet those benchmarks, right? And then they need to know, you know, did you actually work, you know, doing something for 1 year, you know, if that's what you're trying to get across. The Practicode is a product of AAPC, and they use it to give the coder practice and also so that they can accelerate the removal of the A. When you first get your CPC, it has an A for apprentice at the end, and you have to meet a certain number of hours worked or a certain span of time in order to get that A removed. So if you do Practicode, it's that time taken off of the time that you've got to get to meet to take that A off. So that is the answer on that one. So it works for AAPC as far as like their time requirements and practice, but on the outside in the real world, for experience purposes, unless the position is allowing you to substitute education for experience time, and sometimes they'll do that, which is I think a really cool deal, because if you've spent a year in school, you should get some kind of credit towards that, but it just depends on what they want to do. This is why you have to be very specific in your cover letter. Have a really good cover letter, guys. And if you have to do like a different cover letter for every place that you apply, just to sort of fit the needs of whatever company that you're applying for, that's okay. Do that. You've got to do what you have to put yourself in the best light, because you're not going to lie, but you are going to put yourself in the best light. You've got to be able to show all of your talents, because they don't know you for Sue, Jane, or Sally. Or Jane, Jim, whoever, you know. I have to throw the guys' names in here too, because there's more men that are becoming medical coders, which I think is great, because we need some balance in the industry. Women dominate the industry, I'm just saying. But you have to be sure to put yourself in the best light, okay? So that's what you want to do. And you want to be able to tell them more about yourself. And you have to have that compelling cover letter, because that's what's going to grab their attention. Because if your resume looks like every other person's resume, the only thing that's going to make you stand out is that cover letter. Just saying. So at least 3 months of experience performing HCC coding. One of the following credentials through a HEMA or AAPC is required: the CPC, the COC, the CCA, CCS, RHIA, or RHIT. Minimum of GED or high school diploma is required and will be verified. Excellent written and verbal communication skills. Excellent written, verbal, and communication skills. You know what? You know how you're going to be able to show that before they get to see you and before they get to talk to you on the phone? Your cover letter. And then, of course, with your eloquently written resume that looks really fantastic, because you're awesome, because you got through this program, right? This adult learning program, you got through it, okay? You got to make yourself look good, guys, because yes, you can do it. And you may be a little nervous, but don't ever think that you can't do it, because yes, you can. You know, when I hear from viewers and they say, well, I don't know if I can do this. Guys, come on. Yes, you can. If you went through the school, if you got through the school, you passed all the tests, and then you got your certification on top of it, oh, you are ready. You are ready. Don't pump the brakes now, okay? Now's the time to hit the gas, okay? You got to hit the gas, and you've got to start getting out there and really looking for a job. And don't get discouraged, whatever you do, okay? And then it talks about having high-speed internet with good service available at your home. And you got to be tech savvy, it says. That's funny. I've never seen that on a thing before. And it says compensation will be based upon years of experience, education, and credentials. Drug tests, background check, credential verification, and educational check, high school diploma or GED, are required for this position. So they're going to check you out thoroughly. And they do that. That is not unusual to have a full background check. I've been full background checked several times. You know what I'm saying? So, I mean, they're going to know. They're going to know. And it's not about like a credit check or anything like that. It's about like what they're going to be looking for is like if you've had any instances of like a HIPAA thing, you know, like any kind of HIPAA violations or anything like that. If you have a criminal background check, they're looking for like violent offenses and things like that. That's what they're looking for. Of course, it depends on the nature of what happened. And if you do have something in your background, you need to be upfront about it. Okay. So at least because they're going to find it out anyway. So it's going to depend on how long ago was it adjudicated and what the nature of the situation was. Okay. So I'm just saying, it's not all hope is lost if you've got something in your background, but you need to be honest about it. Okay. All right. So benefits offered: weekly pay, medical, dental, and vision insurance, voluntary life, paid training, an opportunity for advancement upon performance and availability. So this company is saying that you can grow, you know? All right. And let's go to another one. Okay. Outpatient Certified Coder on site. Okay. Accountable for conversion of diagnoses and procedures into codes using the ICD-10 code set. CCA, and it's the first one listed. CCA, RHIA, RHIT, CCS is required. 2 or more years of previous hospital experience as a coder is preferred. Preferred, not required. Requires skill in the sequencing of diagnoses and procedures to optimize reimbursement. Ensures that all records are coded in an accurate and timely manner and is able to work with physicians in a collaborative approach for specificity. I like this listing. But, you know, that's it. That's all they said. So being a coder means working with providers, okay? That's what that means. And, you know, I was just checking the time. It means working with providers. It means having a very good communication set. Now, if you are a shy person and you say, well, I'm really shy and I don't really like to talk to people. The thing about coding is when you're really into it, that passion's going to ignite. And that is going to get you out of your shell. That's going to get you to be able to start speaking. But you got to let yourself be okay with wanting to start speaking. You can do it. It's in there, you know, and especially if you start learning that you really like coding, oh yeah, it's going to come out really quick. I have a meme that I posted on, on my Instagram, and it says, when somebody marks me as coders are like peacocks. If somebody tells me that I'm wrong, my feathers come out and my head does a little sideways turn. It's true, because then when you have to actively defend your work, it becomes a very fascinating, a very involved, and really passionate argument. At least that's what it turns into for me. Because when I need to defend my work, I'm doing two things. I'm defending my work, but I'm also defending the work of my provider, because I know that they deserve the most specific, whatever they did, they need to have the most specific codes on there. I'm also doing it for the patient, because the patient deserves to pay what services they actually received. Not something that I'm just going to be like lackadaisical and just shoot it on through. That's not the way to be. And if that's what you're looking for, you want something that's really easy and simple like that, don't do it. Don't get into coding. And only because coding is very involved and it affects so many people. It not only affects you at the end of the day, because if they don't need you as a coder, hello, but it affects the patient. Most of all, it affects a patient, and these people are sick and they have like limited funds. So you don't want to try to be one more person to burden them with incorrectly coding their encounters, okay? It affects the providers because they have to meet a certain number of RVU generation, and they have a certain amount of time to hit this certain number of RVUs, and they have to meet it to fulfill their contract with their facility or wherever they're working, so that the facility can make money. It affects the facility and their ability to be able to keep the lights on, and to be able to pay the staff, and to be able to pay all the workers that are in the hospital, not just the doctors, not just the nurses or the coders, but also like the housekeeping staff and the maintenance crew and everybody else that works at the hospital. There's a huge economy that works in the hospital. It's its own little ecosystem. Think about it, you know, and if they have cafeteria workers in there, they got to be able to pay them too. And whatever the providers are generating is directly linked to how well that coder is looking at those records and working with the provider in conjunction with them to make sure that what's actually happening in that room is actually being reflected on that record. Now, this wasn't supposed to turn into this, but I think it's okay, because explaining these job listings and really kind of understanding the language and what all is going into it and why they're looking for this and why they're looking for that is really huge. A lot of times people will ask me, Bleu, what are they looking for when it comes to a medical coder? The first thing you can look at, job listings. Look at the job listings, because it'll give you the answer right there. What are you looking for? It's right there. That's what they're looking for. So take the time. Check out the job listings. You may learn something, okay, as far as like what they're looking for. And it never hurts, because like, this is the answer. These are the answers, you know. Let's see, what else? Do I have time for one more? Let's see. Oh, I may not have time for one more. Well, maybe I have time for this one. This is Outpatient Coder. Responsible for maintaining high quality ICD-10 and CPT of all outpatient diagnoses and operative procedures. Assigns appropriate CPT modifiers to CPT codes, enters accounts into records, medical records hold for further documentation or change. This one sounds a lot like the other one, doesn't it? I think this is another one. Oh, this is another position, but it's the same. Okay, but here we go. So like on the list of things that they want is different. Okay, it says accurately codes and diagnoses and procedures on all outpatient visits. Verify all outpatient orders are being yummy boy. Verify all outpatient coders orders are complete with an accurate diagnosis for the test or procedure that is performed. High school diploma or GED. Completion of accredited baccalaureate. They want a degree. Health informatics or health information management or an AHIMA approved certificate, coding certificate program preferred. Okay, that's what they want. They want a degree or they want an AHIMA credential. Strong written and verbal communication skills, able to work independently in a remote setting with little supervision, 2 years of outpatient coding or an acute care setting, registered health information administrator, RHIA, registered health information technician, which is the RHIT, the bachelor's and the associates, okay? And then the CCS, the CCA, the CPC, or the COC, which if you don't know is a Certified Outpatient Coder with AAPC, okay? So that's my listings, well, for right now, because I'm going to hit the limit here in a minute. So I'm going to go ahead and wrap this one up, but I hope you enjoyed this one. Now remember, just a little bit of housekeeping at the end. Of course, let's talk about this. I will not be at the premieres next week, but you will still have an episode at 7:30 Central Standard Time, Monday through Friday. So I will be announcing what the video of the day is, usually like on Instagram earlier in the day. So that way I'll upload the video and you will have it. It'll be all scheduled and it's ready for you. So I hope that you'll enjoy all the shows. Leave me a comment and let me know that you're there, you're watching, so that I know that you have any questions. Let me know as well. Continue to send those questions for Q&A Tuesday as well, because it'll be on the following Tuesday. This Q&A Tuesday's listings are already all full, so I've got the show already lined up for Q&A Tuesday. But if I will see y'all again, not next week, but the week after. So I will see y'all then. Have a great week, everybody. Have a great weekend. Thank you for getting me to 5,000 subscribers. Woo! I will see y'all later. Bye.